Lipo gang, welcome back to my channel, y'all. So today we are going to go over my overall experience with my surgery. So today marks my exact 90-day mark. It's been 3 months. So I really wanted to catch y'all up on what y'all haven't seen, my follow-up appointments, stuff like that. And I kind of want to talk about what I feel like women should know, like you ladies should know about getting surgery. And I also kind of want to tell my perspective on it. So I really want to get into this for real, y'all. Thank y'all for coming back, for tuning back in, for really just sticking with me, okay, y'all? I'm gonna tell y'all this every time y'all see me. I'm always gonna tell y'all thank you. I'm always gonna tell y'all I'm grateful because it's genuine. I would not be doing this if it weren't for y'all, because y'all are motivating me to keep going, for real. So I love y'all. Thank y'all. So let me stop talking and really get into really what I want to talk about with y'all. So let's start off with my surgery day. So y'all seen my video, y'all seen, you know, how all that went. Now let me tell y'all, I messed up. I do this all the time though, but I really messed up with this because I've never had cosmetic surgery. So I stayed up super late because I couldn't sleep. Like I said, I don't know nobody who can sleep like a baby the day before surgery. I'm sorry. You gotta be a psychopath to sleep like a baby the day before you finna get put to sleep. Like, I couldn't sleep. So I was like, okay, I wanna see what a breast augmentation looked like and what lipo looked like on YouTube. So I looked at it on YouTube, y'all. I wanted to cry. I was a little nauseous because it looks so brutal. It's just like, yo, I don't even want to do the movement, but you know, the little, whatever that tube is, looks so harsh to the stomach, like the motions. I'm sorry, y'all. The motions, but that's how it is. So I was like, oh my God, I can't believe I'm be doing this to me while I'm asleep. But it is what it is. I got a little sleep. I woke up. The anxiety really started kicking in, like, right when it's time for me to get in the shower and stuff like that. Like, my pits was sweating. So y'all probably was wondering why I had on that bandeau, just a bandeau in the cold. First of all, it was still hot outside. It was very hot outside for it to be November. And I was just too hot. We already couldn't wear no lotion, no deodorant, no none of that. So I was like, you know what? We finna go out and look like I'm finna be comfortable. So I had surgery. When they took me back, I wanted to cry because I'm used to doing a lot of things by myself, but for me, surgery is just something you want to do with your friends, your family, somebody you're comfortable with, a loved one there with you. So just to know that I'm just alone, like, I recorded that for y'all. I really try to be strong. Like, I didn't want to try to be no sad. Like, I didn't want y'all to see me all like sad or crying, and I was terrified, y'all. I have been put to sleep from my wisdom teeth removal, but it wasn't even that, well, my surgery wasn't that long either, but it's way deeper getting put to sleep for, like, getting some boobs, you know what I'm saying? Getting some lipo and whatever else, stuff like that, rather than getting your wisdom teeth removed. Like, it's just two different things. So, you know, I made it out. Y'all see me. I made it out. Came out of surgery super sore. I was in so much pain. Now, like I was saying before, I have a high pain tolerance. I deal with pain every month, and y'all know what I'm talking about. Every 30 days, them cramps put me out. So this is a whole different pain. Like, everything just hurt. I didn't want to move. Like, I was just, and then my face was swole. I did not look that bad because I wasn't looking at myself on camera when I first got out of surgery on my dad. When they put me in the car and I was with my dad, I didn't know what I looked like. Y'all, I look like shit. I don't even cuss. I try my best not to cuss on here, but y'all, I look like complete shit. My face was like so swollen. Like, I look dark everywhere. Like, oh my God, everything. I said it in the video. I looked how I felt. I was not feeling that. But like I told, that was the only thing going through my mind in my video. I was like, I'm ready for the drugs. Because that's really how I felt. I was hurting so bad. I was like, oh my God, I'm just ready to be numb. Like, I'm ready to be calm. So whatever they finna give me, like, I need it. Come on, Dad, run that shit up. Like, I'm sorry, y'all. That's how I was thinking. But let me think. We went to Chick-fil-A and I tore them fries up. But my throat was so harsh. Like, everything hurt to swallow. And so I'm like, what in the world did they do to me while I was asleep? Like, I was freaking out about that in my head because everything hurt. It was just scratchy and it hurt to swallow and everything was ugh. I just felt so ugh. So when I found out, when they called me, that I had a tube in my throat. It wasn't like down, all the way down, but it sat in the back of my throat. So, you know, they made sure I was breathing properly. I didn't like that. I didn't like that because I dealt with that for about 2 weeks. But I got through it. Y'all, let me tell y'all something. Be prepared for this to be an emotional journey, especially doing a lot of this stuff by yourself. So I recorded it so I could show my family, and to be honest, my family didn't see none of my footage, none of it. They saw it with y'all. So that's really how it went for me, and I kind of wish I would have took that into consideration. Like during COVID, I didn't want to travel out. I should have traveled out. I'm not gonna say that I liked my surgery, but now we'll talk about it. I ain't even gonna spill all the tea. Let me not spill all the tea. So we already about what, 5 minutes in or so. So let me just do this. Let's go to we're gonna switch to my first visit after surgery, right? And then I'll come back and talk, and then we'll go on from there. All right, that's what we finna do. All right, we gonna go out.
I like smalls, but they're like super small. All right, girl, you look good.
I didn't think I was gonna be still so swollen in my belly.
Oh, it's gonna take months for all your swelling to go down.
Really?
Mhm. Yeah.
Yeah.
So,
because he was saying like, you know, oh, you should be able to go back to work. You know, if I was working.
right.
And I don't think I would be able to go back to work like this because it's very painful.
Well, everybody's different. Pain medicine wise, are you off the? I'm gonna have you lean back in this chair. Are you off the pain medicine?
No, I am not.
Okay. So, are you taking ibuprofen?
I've started.
Okay. So really the best thing for discomfort at this point in time is ibuprofen. So I would encourage you to take 3 ibuprofen tablets, which is 600 milligrams 3 times a day, okay? The narcotics, I mean, you're just a few days out from surgery, but at this point we like you to start kind of getting off of them. Because they just really kind of make you tired, where the ibuprofen actually works to kind of help with the discomfort better. But everybody's different. I mean, some people are more delicate or take a little bit longer to kind of do their thing than others. So shower you should be doing. Oh, your incisions look great. The glue's in place. The glue should stay in place for the next couple of weeks, okay? So you don't need to do anything to your incision care. I'm gonna send you home with some gauze. You'll just fold a couple of gauzes and put them over your incision. No bathtubs, swimming pools, nothing like that, but you can certainly shower, put lotion on, just not where your incision sites are at. Okay. You want to stay in form of compression because that's going to give you support, and then you want to be in that soft brawl kind of day and night, okay? Let me go grab Dr. Fardos and take a peek at everything, and then we'll go over all your instructions, okay? All right, girlie. Oh, there he is.
Hi, how you doing? You feel better?
Better, yeah, better than Friday. Saturday when you called me, I was like falling asleep on the phone because of the meds.
Yeah, I know. That's okay. Let's take a peek here. How's everything going?
Yeah, she looks good.
Look at you, you look great. That's all good, the glue's on there good. Okay, listen, the breasts are easy. Nothing. Just kind of
take it easy.
Take it easy, nice and slow with the arms. Nothing too drastic, they're healing well. You're swollen. You need some compression on here. She has a little incision there.
Yep, I'm gonna put her little, yep.
And we'll go over all your care. You made it, okay? Let's do a nurse visit next week.
Okay.
Okay.
And then see you back at yours
And
for
then
6
I'm gonna
weeks.
see you back at 6 weeks.
Okay.
Okay?
Yep.
So she can start massage next week.
Yep, got it.
Okay, you're doing good.
Cause I was like, they're so slow and like,
Oh yeah, that's
Yeah, it's all normal. The first week everything's changing, but for 4 days after surgery you look great. You're on the mend. Every day will get a little better.
Okay.
If you need anything or have any questions, give us a call. But we'll see you next week, and then we'll go from there, okay?
All right, girlie, let me go grab the Spanx thing because it's the next stage garment, which will be more comfortable than that wrap, okay? All right.
Thank you.
This is that Assets garment, okay? This is much more comfortable than that Spanx garment or that foam thing.
Okay.
So you don't need to be in that anymore. If you're washing this garment, and you can wash that garment, you don't need the foam anymore. If you want to wash that binder, when you're not in this and you're washing this, you can use that, so you can alternate them.
Okay.
This you can get at Target. If you can order it online. It's a shaper, high waist. I like the mid thigh because I don't like the other ones because they cut into your thighs too much.
Thanks.
But this will be much more comfortable and it's easier to wear, and you want to be in compression day and night. The swelling is normal. It'll take 6 months for all your swelling to go away.
Oh wow.
As you start to become a little bit more active, you may notice swelling, the numbness and tingling and all that itching, that's normal as well.
Okay.
We'll keep your incisions covered with tapes. I'm gonna give you a roll of tape to go home with.
Okay.
We'll see you back next week, and then your glue probably will still be in place till next week.
Okay.
No massage with the breast. Soft bra still, that bra that I've got you in.
Isn't also get another one?
Well, I'm gonna give you the sheet here because this is gonna be more comfortable. Order these on Amazon. They're a zip up front. You'll go based on your height and weight on their chart. You'll probably end up being a medium or a large, but this zips up the front. So if you wanna order these and bring them to your next appointment, we'll make sure they fit okay. And you can go ahead and transition to it now if you wanted to, if you get it within the next couple of days. But Dr. Farley likes you to be in a soft bra. I don't like you to spend money on those because this is going to be more comfortable and you'll be able to use this after surgery. Okay. But you just want to make sure it's like this. I like these because they sit down off your incision so they don't irritate your incision. I'm going to give you a roll of tape to go home with to keep your little lipo spots covered up, and then you'll start taping your breast incisions about 3 weeks, but we won't go over that till next week.
Okay.
And then your gauze, you'll just kind of fold up, and I'll show you how to tuck it into your bra so that way if your bra was to ride up, it won't irritate it. Slowly deliberate arm motions, showering's fine to do, lotion is fine to do, you can sleep flat. I want you to get off the pain medicine. Are you pooping yet?
Yes.
Good.
Sunday.
Good. Okay. Ice is still your friend if it feels good. He doesn't say that you have to live in ice.
So is it supposed to be so warm up here?
Yeah. It's just because it's just a healing. You're high, you're tight, it looks funny. That's all where you're supposed to be right now because that implant's under the muscle. It will take you a good 4 to 6 weeks for this to kind of drop in.
Okay.
And we'll start massage next week. Everybody's a little different. I think by the end of this week, you'll kind of turn the corner. You're still kind of early. But if you'll start that ibuprofen, 3 tablets, 3 times a day, that's 600 milligrams, breakfast, lunch, and dinner, that'll help way better than the pain medicine. Okay, and no bathtub still.
Okay.
So take it easy with your activity, no exercise, you're just kind of laying low this week again. Okay? This is all the instructions we went over with the breast. The lipo, there's really not any instructions except for the compression garment. We'll give you some next week because you have a little bit more at that point because we'll start some massage as well. You just need to lay low this week.
So
okay?
Massage.
Yeah, you're just going to kind of take when you're in the shower, put lotion on your skin, just big circle motions over your belly.
Okay.
Right now, you're not ready for that. You'll be like, this does not feel very comfortable.
Yeah, I know what you mean.
You're like, I do not want to do this yet. Okay, so what I'll do is I'll adjust your bra, and then I'm going to cover your little lipo spots with tape, okay? And you'll just kind of keep this spot covered with a couple of pieces of tape. And then you should have you've got 2 little spots lower. And the little sutures will remove next week if they're kind of still hanging around.
Okay.
Sometimes the tapes will just kind of pull them off next week, but. Yeah. Yeah, you look fine. Now don't be alarmed if towards the end of I don't want you to overdo it activity-wise. I want you up walking around and stuff, but you still need to take it easy, especially with the upper body.
Okay.
You can hurt your boobs if you do too much.
Okay.
You can cause bleeding, you can change the shape. So elbows still closer to your side, slow deliberate motions alternating right and left. Don't overdo it. If you do something and it starts to hurt at the base of the breast, you gotta stop what you're doing.
Okay, y'all. So let's talk about my first visit. So my first visit after surgery was about 4 days. I was still sore. I was still stiff. Like everything was swollen. I was so impatient. I still am kind of impatient with myself and with my body because I really didn't maybe I didn't pay attention, okay? Because I don't want to say I didn't know. I'm going to say I didn't pay attention because I can have selective hearing at times. I can hear what I want to hear. So I didn't know it was going to take about 6 months. So 6 months is what they say, you know, kind of what your body needs to heal. Now, they also said 6 months to a year, of course. Like, I mean, a whole year is better than 6 months when it comes to the body healing. If you ask me, almost anything, you know. But 6 months is what they said for me to actually see more so my real results. So coming to this, I'm like, oh my God. I'm looking at my boobs. I'm like, oh, they so big. I'm looking at my stomach like it's so big and puffy. Like, I was freaking out. I didn't like it, but you know, I was just trying to stay optimistic because I know, like, it was just 4 days ago I had surgery. Like, everything not gonna be perfect. I knew that, but it was just like I kind of thought it'll look a little bit different than it did. So at this appointment, they was checking out everything. They was telling me that everything was fine. He actually told me I was healing nicely. They, what did they tell me? They was telling me about changing into a sports bra. They call it a soft bra. A soft bra is nothing but a sports bra. I am going to link everything in my description box that I was given over those appointments, because every checkup appointment I basically got something new. And excuse me if I like rush into what I was given, but I just want to make sure y'all get it all. So if I repeat those things throughout the video, I just want to make sure that I'm telling y'all the right stuff and I don't forget, because I will forget. I'm very forgetful. So yeah, they was talking about the soft bra. They started giving me stuff to cover my incisions with. The doctor talked to me, you know, I kind of told him like, what's going on? I'm so big. But so that was pretty much that, you know. They were just, you know, reassuring me that everything was okay. They was basically getting me to the next step of being out of my surgical bra, because I hated that surgical bra. I liked it at first, but after a while, it just really started hurting here. And I'm not gonna lie to y'all, I guess because I'm used to being bare, like before I had my surgery, I didn't really wear a bra like that. Not all the time, depending on where I was at, of course, and the setting and occasion. But at home, I really didn't wear no bra. I ain't even wear no sports bra for real. Like, I used to always be out in the bare. So it just started hurting here, and honestly, I just feel like I still have that pain because, of course, I'm always in a sports bra. Like, I'm always in something. Like, I try my best now not to not have on a bra. I mean, of course, now I don't. I'm bare because of what I'm wearing, and I wanted to really be able to show y'all. Y'all know y'all get to see my results. But let's go over to my second appointment. So they had me come back a week after my first post-op appointment. So let's go ahead and talk about that. I'm gonna get into the video, and then I'm gonna come back and talk to y'all.
Sorry. No, you're good. So you can start changing your tapes once that glue comes off. I'll give you some tape to put over your breast incisions. You can do that once a week. Okay. Just make sure they're completely dry before you put your bra on after a shower. Okay. Still kind of take it easy, no resistance workouts or weights or anything like that. You can do a little bit of like cardio. Okay. You'll continue your compression. Do you have a Spanx yet?
I do, but I'm having a hard time finding the Spanx that fit because they don't fit.
So Target has a brand called Assets. They're very similar, they're just less expensive.
Yeah, they gave them, that's who I've been trying to go through, but they are not curvy friendly at all.
No, okay. Still avoid submerging in water, tubs, bath, you know, anything like that. And then, so kind of keep your arm movement slow. And then you're gonna start breast massage. You're just squeezing the base and releasing. You'll do that 10 times, 3 times a day. So you just squeeze and release. And then you'll stay in your soft bra day and night till 6 weeks. Make sure you're just protecting your incisions from sun if you're out in the swimsuit or anything. And then still no dental work till 6 months.
Perfect.
And then look at your, underneath your plus incisions here.
It's like really sensitive.
Yeah, it feels weird, right? That's normal. It's just all those nerves reconnecting. Okay, so there's still a little bit of glue. It's not quite ready over there. And the same on this side. Probably in the next day or so, it'll be ready to completely come off. And then you can start putting those tapes over those incisions. I'm gonna go ahead and retape your Lipo incisions. Then I'll give you a couple little tapes to take home with you.
Okay, so how long do I stay in the sports bra for?
Until 6 weeks.
Okay.
At 6 weeks, you can kind of get into an underwire bra, and you kind of get to go back into more activity and things like that too. We'll give you all that when you come for your next appointment. But for now, just stay day and night in the sports bra.
That was fast now. Back way faster than I thought it would be. Alright, y'all can see my swelling is going down a little bit more, but it still hurts up in here. But stomach looks a lot noticeably different. I just hope this goes down a whole lot more. All up in here. Okay, so let's talk about the next visit. So this visit was the following week after that. And so I had already got my bra, so that was fine. I ended up getting a large in my bra, and it was ended up being decent. And then they checked they're always gonna check your incisions, all your sites where, you know, you had something done to it or whatever. So they was telling me everything was fine. My glue hat was starting to peel under my boob, so I was gonna get ready to put like kind of a tape over it. I kind of consider it like a band-aid, like a really strong band-aid, because it's kind of sort of what it was. And then they had I put gauze over that because I was wearing my sports bra and they didn't want it to get irritated, so I wore that for a while. What else did I get? They started telling me that I needed to purchase my Spanx. So with the Spanx, I was given recommended a brand called Assets. Now for me, and then they told me to go to Target. Now for me, I'm not, by all means, I'm not, when I say curvy, you know, I've seen women way thicker than me. So I'm in double size in jeans. So let's just put it that way. And for me, I couldn't find anything that fit up my thigh. I really couldn't. But let me tell y'all what I feel about this part. So my doctor, I love my doctor. Now, by no means am I bashing my doctor, but I love him. I really do. Because I ain't never met a person so down to earth, and I've never been comfortable with a male doctor. So, and we like this. If I got a problem, I can call the office and we good. But from my personal experience, I'm trying not to cuss because I'm trying not to let my frustrations show on camera. But forget them damn Spanx, okay? Forget them damn Spanx. Forget that damn binder I was in. I hated that binder. Faja it up, okay? Now, my doctor is more of a, you know, natural looking doctor. He don't really like to do those big crazy surgeries, okay? So he was more so, he didn't say I couldn't do it. He just told me to wait. Like the post-op massages, lymphatic drainage, da-da-da-da. He wanted me to wait some weeks before I did that. So when you see most people do those type of surgeries, they do it, like if I'm not mistaken, I want to say the day after surgery. And if not, the day after 2 days or something like that. Now let me tell you something about me. I mean, I guess I was doing fine after surgery, but I was, after the numbness kind of wore off on my belly, because my boobs hurt. They ain't never stopped. They ain't never stopped doing that, period. But when the numbness wore off my belly, oh no, it was sensitive to touch. So when I was in the shower, like I was just really bathing, real slow motions. Like, oh my God, I couldn't even imagine nobody. Like, you know how the surgeries go for post-op. They really like, you know, trying to get all that stuff out, all those liquids out. I don't even know exactly what it is. So I'm not finna say nothing on, I can't speak on, but whatever that stuff is, you know, all that little liquid that's coming out, y'all saw it coming out. It wasn't just blood. It was like a brownish, it was, I don't know. Whatever happens when you lipo, that stuff come out of you too. You drain. But they say like a day or two after that you're supposed to go. I should have did it. I did not. I did it later. I did it when I was about almost about a month after surgery. That's when I started getting my massages. And I'm actually going to show y'all that stuff, but I'm not going to show y'all that stuff in this video. I'm going to do it separate because I don't want to keep y'all here for too long. So I say get a faja. Now if you choose like me to stay in the state you live in and do that, like I said, depending on your doctor, he does more natural looking stuff. Even with my lipo, it's more natural looking. It's not like super sucked in or whatever the case may be. I still got less work I want to do on myself. So, but it is what it is. So, if I go back to November, I would have bought me a faja right in there, and I would have been in my faja the whole time. Now I'm in my faja all the time. Like I really don't come out of it. So that's just my piece of advice. Then that second appointment, yeah, they snipped my incision, because you know, whatever it is, you know, the stitches, there we go, sorry y'all, the stitches where my incisions was for my lipo. They just went on ahead and snipped them because they really hadn't fallen off yet. I got into a different bra, and at this point, y'all can see I'm still looking at myself like, dang, I'm still slow. Like, what's the tea? What's going on, y'all? Like I said, I wasn't patient. Like, I was just so ready to see the results. Like, I was. That was my fault. But I learned that when it comes to the surgery stuff, you gotta be patient. What y'all see on Instagram or whatever case may be, like, they don't really show y'all what they went through to get it. Like, and then the way they do it is they get all their content before surgery, like they back to back to back, and while they're healing, they're still posting, so you never know they was even gone for a month or 2 months. Like, you never even know. Me, I just got on social media. I ain't care about none of it. I just disappeared. Like, I needed that break anyways. I just left y'all. I'm sorry, I love y'all, but I just need a break. I wasn't ready. I was not ready. But by that appointment, y'all, I was really good. Y'all seen I got up and did my wig, the second day or the third day after surgery? I wasn't playing them games. Like, I was like, this bunny gotta go. I look like somebody's auntie. I'm tired of looking like that. I'm ready to get cute. And it is what it is. Cause I know I'm sitting home, but it was doing something to me. I already was helpless. Like, I needed to be cute. So I was fine. I mean, I was driving if I wanted to, but I was really trying to lay low, stay at the house for the most part. I'm gonna show y'all just a few clips. Like, I'm gonna probably put it over here. I'm gonna show y'all a little bit of like what I was doing at home. I was just having a whole bunch of dance sessions, and you know, I was just getting my stuff in. I was having a little fun by myself at home, because I showed cut on some music real quick, and I was doing whatever I wanted to do. So yes, I definitely was fine, but I still was taking it easy. I wasn't doing no lifting. I barely was cleaning because I wasn't supposed to do that. Like, I wasn't supposed to lift my arms up and do a whole lot of stretching and reaching and stuff like that. So, but I kind of, mix it in just a little bit here and there, on a good day when that doggone that pill kicked in. Like, when the pills kick in, you invincible. Like, you don't feel no pain. But I ain't really do too much. Yeah, so let me stop talking. We need to get into the final appointment. We can get into my final appointment, and then I can talk to y'all about everything since then. All right, let's go.
Bra fit, the underwire, you want to go up just a little bit so that it protects all these nice folds, okay?
Okay. What do you mean go up?
Like the underwire, like a demi bra, the underwire in the bra cups goes up just a little bit further instead of stopping. Like, some of them stop more laterally. And you want one that goes up just a little bit more.
A little bit more here.
Yes.
Okay.
Yes.
Okay.
And sits flush, just because that protects all your folds and stuff. Okay. There's some different instructions on the Lipo section. And what most likely recommend is those scar pads that they hand out for. Those you can reuse. You can even cut them in half for like the lipo spots.
Mhm.
And put them on there, take them off when you bathe, and then just put them back on. And wear those for another 6 to 8 weeks. And that just helps prevent the friction can cause the scar to thicken a little bit, and then coloration and stuff. And so that just helps with that. It helps prevent all that. Are you happy with the size of your breast?
Yes.
Good.
I love him.
Good,
I'm
good.
so glad that he went up because I just imagine like I know I wanted to do like at first 350 and I'm 425. I was like, oh my god, I probably would have cried because they still would have been too small.
Hi, how are you?
How are
Good to
you?
see you. Merry Christmas. Okay, how you feeling? You make it?
Yes.
Good.
I did.
So at this point, you're still going to have swelling. Don't worry, that's normal. It takes a good 6 months for all that swelling to go away. You're going to have some numbness. That's all normal. But otherwise, you should be feeling pretty good. Let's take a peek.
Here.
Come on over to me. What do you think so far? You seeing any changes?
I mean, I do see changes.
You're still swollen in here, but this looks good. Your little scars look great. They're going to soften. At this point, you don't need garments or anything. You can we're going to go over scar care for that. I'd like you to put a little of the silicone tape on there. That'll really help. Diet and exercise. Start the new, wait till the new year. But start the new year with a good diet exercise plan. I tell all liposuction patients if you can lose 5 pounds, I think it helps your result even more. So, and we'll kind of let this all continue to get better and better over time. I think you'll be great in the spring. I'll see you back at your 6-month visit. So if you need anything before then, you can call me anytime. You can always come in too.
So I have a question. When would I be able to do more workouts that involve using like the chest?
What do you want to do?
Well, I want to be the trainer
Okay.
at the top of the new year, but I also like doing pole fitness
Okay.
as well. And I know, you use a lot of arm training.
I think that's okay. I just tell women I recommend not doing like bench press or flies.
Oh,
That's all. The other stuff I think you're fine to do.
okay.
But just don't do like push-ups and bench press where you're always contracting the pec muscle because it can push implants up to the side.
Okay. And then like the only pain I feel like I still have now is up here.
Okay.
So like if I try to lay flat, it's okay for a while, but then it just feels like all the pressure just goes right
And
there.
how long is that? How long are we out from that?
6 weeks.
Yeah. You got time. You're going to see changes, and that's the same thing. 6 months. Okay?
And I'm glad you did the 425 because at first, the day of surgery, and like I was like, oh my god, they're like up here. What are they? But then I'm looking at them like, oh my goodness, this was the perfect size. To me, they don't look big at all. They just look like full.
Yep. It looks good. You're very balanced. I'm very happy the way you look.
I really want to say thank you.
My pleasure. I'm glad you're doing so well. You look great. You know what? It only gets better over time, so you'll look even better at 6 months. But we'll start the scar care underneath, and you can use it
So
on
how
your
do my
episode.
scars actually look to you? Like,
They're doing good. Yeah, little color on them is normal. That'll fade. The color is the last thing to go. The scar treatment will help with the thickness.
okay. And then when we did the lipo, how much did you actually get out for the surgery?
I think you were about 750 cc's. So it was enough it's going to make a difference, but it wasn't over resective.
Okay.
So it was just under a liter.
Okay, y'all. So then I had my 6th week, right? So y'all saw it. Y'all saw the footage. Y'all can see me. Y'all saw what I said. Y'all saw me in that faja. Like I wasn't playing them games. Like I was in that faja. And even then they told me like, oh, by now you can just go on ahead and stop wearing, your garments and stuff like that because you want your muscles to naturally do their own thing and form how they want. I wasn't hearing none of that. I'm sorry, excuse me. I wasn't hearing none of that. I was like, I'm not coming out of this faja. I appreciate y'all's advice, but I'm trying to be snatched. Because, of course, I was still swollen. He was like, you're still swollen. He was like, it's going to take 6 months. I'm like, 6 months? Like, 6 months? Like, why did I listen to this? Because 6 months is a long time to see what my stomach going to do. I was a little disappointed. But, y'all, I don't know if I told y'all, but my boobs are 425 cc's. Now, when I went into surgery, I said 375 to 400, but I also had a talk with the doctor right, before surgery, and I was like, I know, you said you could switch them out, see what looked good. I trust you. Like, I really do still trust my doctor. And so when I learned that I had 425 cc's in my chest, I was like, oh my God. My boob's gonna be huge. Like, but I'm gonna show y'all that in a minute. But I love him. I'm glad that he went with the size he went with. Because I'm like, dang, to think I only was getting ready to start out at a 325. Like, that was small, y'all. That was small. Now, I was a 34B. Y'all, I am a 34 double D now. I never thought I'd ever see that in my life. When I tell y'all, when I look at my bras though, I really want to show y'all my old bras versus my new bras. I really do. I feel like my new bras now, like the cup is like, oh my God, let me see. I swear to, I don't even know. I can't even show y'all, but my bras look so huge. They really do. But it's just looking like, dang, I was this small and now I'm this much bigger. But on me, like looking at them on me, they don't look that big. They're so proportionate. So I'm gonna show y'all that in a minute, but I was kind of telling them, like, y'all, I'm not really satisfied with what's going on. Like, I mean, like, I love my boobs. At that point, I'm like, okay, I'm starting to see how they look. And, they were starting to drop. But, ooh, they were sitting on my chest at first. They were sitting up here, for real. And I'm, like, looking at me now and just like, dang, they done dropped so much. But I was like, okay, with my lipo, like, I know I'm still swollen, but like, think about looking at females that come right out of surgery. Y'all can see, like, they flat. They still be swollen, but they like flat. So I'm like, I didn't expect to be like super flat, and I didn't want to have a surgery where I look like my torso looks stretched out, like super long. I'm sorry for the face, but that's nasty. I don't like it. Looked like some like I don't want that. I just want it to be, the fat gone enough where I can sculpt my ass by some sit-ups. Like, sit-ups ain't bad. I just was not doing all of that, like losing all that fat. I wasn't doing all that by myself. I need a little assistance. But when I got to my 6-week appointment, I'm like, some of the things I wanted to get rid of is still there. So how y'all really think I'm be looking in 6 months? Because I know I'm only 6 weeks in, but this little pudge at the bottom of my stomach is still there. Like, what's going on? So they just told me to give him more time. Then I found out he took out under a liter for my lipo. He said about 750 cc's. Kind of wish he would have just went to the whole liter. Like, I'm gonna show you what I'm talking about in a minute. But I mean, overall, I'm just proud of myself for getting through that surgery. I'm so grateful for my family. I'm so grateful for my family being there, because I could not have done this without them. Oh my God. I don't have no boyfriend, not in a relationship, so it ain't like I had a man to, do all these little things for me or help me. I didn't. So if it weren't for my family, I would have literally been on my own doing all this. And I couldn't have done it by myself. Y'all don't do it by yourself. And then y'all gonna be emotional too. Don't go through this by yourself. Don't do it. But I want to go ahead and show y'all the 3-month, 90-day, where I'm at right now, like that look. So I want to talk to y'all first. I'm getting stretch marks. Now, if anybody knows me, if you guys have paid attention to my videos, if you looked at my swimsuit video, my very first video I ever done, y'all would see I have stretch marks everywhere. I have them on the inside of my arms. They're very light, so they're different on my body. They're very light inside of here. I have them on the sides, on my sides. They are dark. I had stretch marks on my butt. They used to be dark, and now they're light, and then now they're I don't know, kind of mixed around in certain areas around my hips. So I have them on my calf muscles. I have stretch marks on my calf muscles. I have stretch marks everywhere. And I did have stretch marks on my boobs already. They were at the bottom. And I really didn't have no boobs, so you couldn't really tell. Now I'm getting stretch marks at the top. Now I don't know. I know for a fact it can't be nothing on my doctor's part. Like, he ain't doing nothing to me. Like, but put boobs in me. The only thing is, I went from a 34B to a 34 double D. So my skin is stretching. Now, I did keep my skin moisturized. So I don't want to be like, oh, well, did you moisturize? I moisturize like crazy. I always moisturize. I really think it's because of the simple fact that I went from nothing. I don't even want to say the something because I feel like my boobs are everything. Like, I went from nothing to everything. So, I don't know. I just, like I was speaking to a lot of people about those concerns, and they were like, you know, some people are just prone to stretch marks. Like, you do have them all over your body. So, I mean, they like, you know, keep doing what you're doing, keep moisturizing, keep using your products for stretch marks. I think I'm gonna switch up what I've been doing, because what I've been using has been working on like my size and stuff. But to be honest, I'm not all that self-conscious about my stretch marks on my body. To me, I can honestly give a fuck. Like, sorry, I'm gonna stop cussing, y'all. But I could not care less about the stretch marks on my body. I'm not ashamed of it because I used to be like a toothpick. And now I'm like too big. I just play. But no, I got some weight on me, and I'm proud of that. So I really don't care about my stretch marks that much. But my stretch marks on my boobs at that top, I care about, because it's just like, you know, I'm finna be wearing a whole lot of sweetheart neck stuff. You know, sweetheart is like this. It kind of goes like that. So like a corset. Think about a corset, stuff like that. I'm gonna be wearing a lot of bandeau tops, like all that. Even in my bathing suits. I don't want to see no stretch marks. So I got a couple more months. I got some good stuff coming up where I'm going to even be in the bikini and still doing all this celebrating stuff. So I'm going to keep using, like I said, I'm switching up my products. But I'm going to keep using on there, and I'm going to pray that they go away. And you already know me. I'm going to call my doctor and ask him, because it's really just kind of happened out of nowhere. So I'm really going to ask him, like, is there something I can do? Is there some type of cosmetic procedure? I don't care, y'all. Y'all might talk about me because y'all know she going crazy. I ain't going crazy with these surgeries. I do got stuff I want to do, but y'all, I ain't going overboard. But I need to figure it out. Like, what can I do? Because I just don't want it on my boobs. I'm sorry, y'all. I can have it anywhere else. But I don't want it at the very top of my boob. Like, I'm fine with it being up under here. I've been living with that for years. So didn't care. But I'm just hoping maybe what they're probably gonna do is shrink over time. All my stretch marks over time reduce. Like, they get smaller and they start to get lighter. So we're gonna pray that that's what happens. But y'all, let me go ahead and show y'all what I'm looking like right now. All right, y'all, I'm back. I'm a little out of focus, sorry, but I kind of wanted the main focus to be here in my stomach. So let me, well, first of all, y'all see me, y'all see, like, I'm doing my thing. Y'all can kind of see my belly, like, it ain't that bad. Now, first of all, let's get to the boobs. Let's get to the boobs first. Let me show y'all my scar. And that's what I forgot to tell y'all, that Scarway. I forgot the Scarway pad. That's what if I'm not mistaken, they gave me that at my last appointment. It's these little silicone, they look like Band-Aids as well. And there's silicone on them, and you put them on there, it's supposed to reduce the thickness of the scar. And then he told me, like, over time the color go away. But honestly, I'm not really wearing nothing where that shows or whatever. Now let me show y'all. Ooh, sorry, I'm gonna have to blur it out, but let me show y'all this. I already had these stretch marks underneath my boobs, so I ain't even worried about that. Now this is the new stretch marks. As you can see, you can see them there. And this side isn't that bad, but once, like, I don't know, they started to get really red out of nowhere and they start showing a lot. Then this side is the woo! Do y'all see that? And then if y'all can see, y'all can tell I'm getting them more on this side. See, look, let me show y'all. This side don't look nothing like this side. And then, as you can see, it's so much darker. Yeah, that's a problem. I just need them to lighten up. I just need them to lighten up. That's all I want. I just want them to lighten up. But yeah, that's what happens when you go from nothing to everything. That's what I say, nothing to everything. Now my belly. Now let me tell y'all something. I forgot to do like a pre-picture, all that, do measurements, because they did that at the doctor's office. Now hopefully I can get those measurements and pictures. If not, I'm just gonna have to go from what I looked like the first day of surgery. So I put a screenshot in here somewhere. I'm gonna try to keep me open so I can show y'all kind of what I look like based off that video y'all saw me in the day of surgery. But this is the belly. Now look, let me tell y'all something, okay? Like, this is me trying to poke my belly out. Like, I don't know, I gotta do all the extraness. This is my belly from the side. This is my belly. Now I still get bloated when I eat. That didn't change. I'm trying to see if I can show y'all. Like, I'm not sucked in. This is how I wish I was. I can't. Look, I need to get it gone too, but listen, this is me sucked in. Sucked in, sucked in. Look, y'all still see it. I release all that. So yeah, this is my belly now. Again, doctors say wait 6 months, but I really wanted to see what I was gonna be looking like. And I really do. I do have a measuring tape because I actually do want to measure like where I'm at. So I'm gonna get this now. We're gonna do 3 areas. We're gonna do here, we're gonna do here, then I'm gonna do here, because this is what I was saying that I wanted gone. Like, this is usually the hardest part to get gone on the stomach. This is where you store the majority of fat, us women anyways. So, let's see. I need to get an electronic one of these. I mean, like, they have one. I got the old fashioned. So, this thing is cold. Hopefully, I do this right. And y'all gonna be like, girl, that was not the right number. So, right at my belly button, I'm gonna just say about 30 around my belly button. Then, try to lift this up a little bit. Around here. I think it said 28 and a half. Yeah, about 28 and a half. And then, I was supposed to do, I'm gonna do right above my belly button and see if it's different from right at my belly button. 28 and a half. Yeah, so, and then let's do it where I'm gonna look good. I'm at 31 and a half. I'm good. I'm gonna look good right there. So, but yeah, y'all, this is what I'm working with. Like, I'm not all the way healed yet, but this is where I'm at now. Like, the goal is to like get all, like, I don't know, like, I don't know, I still got a little fat in the tummy, but I'm trying to get toned. I'm trying to tone this up. But I mean, truthfully speaking, like having my stuff like this, it don't look bad. Like, it really don't look bad at all. It's just, I don't know. I used to be skinny, and so I know how my stomach used to look, so I know how it can look. And I kind of wanted to, I just want to get it toned back up. I ain't necessarily not trying to have no 6 packs and then like that. Like, I want to tone though. So that's the goal. Like, I didn't get 360 lipo. I didn't get that done. All I literally got done was my abdomen. Like, this is all, the only thing that they did. My incisions were right here, and literally underneath my belly ring. That's it. So, I mean, yeah, everybody else gets snatched, so I didn't get all this taken out, and I didn't get all that done. I literally just got this area done because that was my problematic area. Now, if I ever go back, they just gonna have to snatch it from everywhere. Like, I don't know, take it from the back. And I don't really have fat on my back like that, but y'all can take it all. Y'all, but just bear with me. Like, I really wanted to be really honest, truthful, and everything with y'all about this whole process. Like I said, I really hope I didn't leave anything out, but knowing me, I know I can't not leave out information. Like, I gotta share it with y'all. So if I did miss something, y'all gonna know. But really, y'all, I say faja. Like, if y'all remember nothing else, faja, have your sports bar ready, make sure you get fitted. You know, I guess, man, I'm just say 2 months in, get fitted. If y'all can't wait like me, I waited at my 6th week. No, yeah, my 6 weeks to get fitted. Make sure y'all moisturize. Make sure y'all do research before y'all get these surgeries done. Research y'all doctors, look at all their work so you kind of get an overall generalized idea of how they, you know, what they work look like. And let me think. Be patient with yourself and your body. Don't overdo anything. Listen to the instructions that your doctor give. Let me think. I mean, and just really be prepared for your body to go through these changes. And whether you think so or not, oh yeah, it definitely hits. It definitely hits you mentally, because physically it's just all these changes, all the pain, you know, always needing help. You know, it's just so much even for me. Like, I'm going right now, y'all. Let me tell y'all. I told y'all, pushing carrots to highs and lows. Like, I'm not gonna come over here on here cute all day. Like, y'all see me, I ain't even got no makeup. Like, I'm not coming on here cute every day, and I'm not gonna pretend like all my days are good days, because honestly, I have a lot of bad days. Like, all my days not good. What I'm dealing with right now, not being able to fit my clothes. Now, I thought I was prepared, but I was not, because my sizes are all over the place right now. I'm somewhere between small, medium, but in my jeans, I only went down a size, and I don't know. It just get crazy because I went down a size because of my waist. Some jeans are too still tight in the thigh, but some jeans are too loose at 11. Well, no, I'm sorry, 11, 13, because I used to be a 15, and now I'm a 13, but I'm somewhere in between a 13 and a 15. Just, it doesn't fit in the waist at a 15. So yeah, that's kind of been killing me. And then, like, in my clothes, I'm mostly a medium, but depending on what it is, I might have to do a large in the bottom, because some stuff is too tight. Like, it fit tight, run small. So, and some stuff I have, I'm like, oh my God, I need a small. This medium is huge. So I'm all over the place. Now, that's doing something to me, because I got a lot of stuff in my closet. A lot of stuff in my closet. A lot of cute stuff in my closet. And guess what? I can't even fit it. Like, that does something to me. That's very sad. Like, that does, like, oh my God. But y'all just be ready to go through these things. Now, I'm sorry for keeping y'all here this long. I really, hopefully, I don't want this video to be too long, but I hope that y'all got to learn something from it, just from the videos I posted, the stuff I talked to you guys about. Y'all pray for me that when y'all see me at the 6-month mark, like, I just be snatched, and I got these stretch marks under wraps. For real, because that's just, you know, kind of what I'm working with. This is where I'm at, and it is what it is. But I really want to make sure I be honest, truthful, transparent with y'all. I'm not trying to act like, come on here in front like this ain't that, because I'm going to let y'all know what it is. That's me. If y'all don't know me personally, if my friends, hey friends, not watching this, it's just, you know, y'all getting to know me, like, I don't sugarcoat. I'm not even finna sugarcoat. I'm going to let y'all know what it is. Y'all got questions for me about anything? I do talk to my subscribers. Like, I do, like, connect with y'all. So whatever y'all want to know, whether it's just about me, about surgery in general, do y'all want to know about, you know, the office that I went to, whatever y'all want to know, let me know. I got y'all. So I'm gonna end this video, all right? But y'all, I'm finna tell y'all a couple things. First of all, y'all already know what's coming. Like, comment, and subscribe, okay? And then tell other people to subscribe, all right? Because don't be stingy. Share me. Share me. But, nah, for real, though, I love y'all so much. I really love y'all for sticking with me, though. And then, before I forget, if y'all seeing this, let's please, like, I want to make an ass out of myself. Like, I don't. Y'all should be seeing this. This should be dropping President's Day. So that means that Valentine's Day already passed. Y'all go follow me on Instagram at Pushing Kilos. Same way that my YouTube name is the same way for my IG. I got some real bomb pictures that I want y'all to see. I really showed out for y'all. Go like them. And then, if you haven't seen it already, go look at my lingerie try-on haul, because it was, like, heavily requested. And I was like, well, let me give them a treat. So go back and look at that video if y'all haven't, y'all. I really had some nice pieces. I really grew up for y'all because I ain't had no cute lingerie like that. I grew up, I bought sets. I don't like thongs, but I bought thongs to go with the sets. Like for when I get a bae and I can like put on a little piece and you know, I'll be all cute and confident and stuff. Like, I'm just playing, let me stop. But no, for real, go look at that video. Like that video too, comment on it, let me know what y'all think. Rate it with me because I rated them. I tried to anyways. I kind of felt like everything was a 10 on you, girl, but no. But go check that video out, y'all. We already been here too long, so I'm not gonna keep y'all no much longer. I really just want to say for the last time, I know I say this too much, but I love y'all. Thank y'all so much for like really making me like really commit to this. Cause at first I was like, forget this, but I'm like, because of y'all, look, y'all seeing Pusha Kilos. Like Pusha Kilos here to stay. I know y'all like seeing this face. I'ma shut up. I'm done, y'all. Alright, y'all, till next time, I got some stuff coming up for y'all, so y'all need to make sure y'all hit that notification bell so y'all get to see when I got new stuff coming up. Alright, y'all, I love y'all. Y'all have a good night, a good day whenever y'all watching this, and y'all will be seeing me soon. We out.